But the other thing is, how the
happy.
heck did we all get to this? How did that happen? Like a flash, right? I mean, it's in 4 months, I go on Social Security at normal retirement age. And I remember talking when I was in my 30s thinking, gosh, is Social Security even going to be there?
Right.
Is it going to be around? And here it is.
Please.
Yeah, all the money that we have paid in, finally, I start to get some of it back, right? So, but I think tonight you're going to find a lot of good information that we're going to be able to give to you. A year ago, when I turned 65, I don't know about you guys, but I got flooded with information about what to do with Medicare, and it was just come to this one, come see us here, come do that, make a phone call here. And I think tonight, Cindy, who's been with us for almost 30 years now at Dempsey Weiss, I think she's going to be able to put it down into a place where you're going to feel comfortable and knowledgeable and understand maybe the process and what's maybe next, the next steps to do. The piece that I'm going to do after that is I'm going to talk about, Social Security. When is the best time for you to take Social Security? Is it to do it when I'm 62 or normal retirement age, or hold off till I'm 70 years old? What are the best places for me when I'm beginning to start wanting income from my investments and from my monies that I put away? When is the best time for me to start taking that? And what's the safest way for me to take that money out? So we're going to talk about that tonight. But I think we're going to be able to unravel some of the mystery of, you moving over to Medicare. I do want to thank a couple of our folks that are here from Dempsey Weiss. Of course, Cindy McQuaid has been, like I said, with us 30 years almost. And many of you here in this room have utilized Cindy for, your health insurance needs. Ashley Harlan, health insurance coordinator with us.
Yeah.
Rena Dopke, excuse me,
taken them a year.
has been with us also as a health insurance coordinator, and Judy Long as well for our health insurance division. In the back is the guy that really makes it all happen.
Mm-hmm.
He's been with us for over 15 years now, and really Vince does it all. He's our director of administration at Dempsey Weiss, and Vince Young. And by the way, his sister is also my right hand. She is the person that I depend on so very much. So, and then also we have Janet with us in the back, who is our consultant for all of our media work that we do, our social media. So thank those groups for putting all this together. But Cindy, it's yours.
Hello, everybody. So some of you I've probably been dealing with, because just a little, we do the group health insurance, we do individual insurance, we do Get Covered New Jersey. So we usually have been talking to people before Medicare and they just call us right away, right? So let's see if I can fight with the clicker or not. So our whole idea tonight is to reduce stress, okay? Try and give you education, overview of what's available, and kind of feel comfortable with what's going on with Medicare, okay? Am I on your way? No. Okay, you all have this in that folder, the little PowerPoint presentation, if it gets too small, or, yeah, on that side, yep. You can write notes on it, there's a note sheet in the back. So a little bit about Dempsey Weiss, those that don't know, there was a few people. They were founded in 1989, shows our ages again, right? We have been working with Medicare recipients since 2000. That's when I got my license. Family owned and operated, and there's plenty of more information on our website. Okay. So first,
hey, Cindy, just quick, how many clients do we now have that have Medicare with us, their Medicare Supplement?
Got to be at least 1,000. At least 1,000.
1,000 clients with their Medicare supplements with us.
Mm-hmm. So we're going to go over, everybody starts talking about Medicare, Medicare Sup, Med Advantage. Well, we got to go over the parts first, okay? So Part A is your hospitalization. Part B is everything medical, doctors, physical therapy, anything outside the hospital, right? A's in the hospital, B's outside. Part C is where you make a decision on how you want to work with your Medicare A and B. And I'll stop right here. Everybody needs A and B. No matter which path you go, an Advantage plan or a Medicare Supplemental plan, you have to have A and B. Do I see a question? So Medicare Supplemental, well, we'll get more into that. And then Part D, you see referred to, is drug cards, prescription drug cards. They came out in 2005. I clicked too fast on this thing. I'm going the wrong way, Dave. All right. So the first thing, everybody pays a rate. So Medicare Part A, as long as you worked 40 quarters or more in your lifetime and paid your Medicare taxes, you don't pay for Part A. That's at no cost. Okay? Part B is where things get different. It's based on your income. We'll go over the incomes. The standard rate that everybody pays for Medicare Part B is $185 a month. Okay? It varies based on your income. So this little sheet, and this is in your pamphlets, so Medicare will go back and look at your tax return from 2 years ago when you're ready to apply for Medicare. That's the income they look at. And you got to figure out your modified adjusted income. And then there are some other, is it adjusted gross income? Some of these you have to add back in. You have to add some of the following deductions in and note on their IRA contributions, stuff like that. I usually tell people it's the adjusted gross income line on your tax return. Okay? So that number is going to be based on what you pay for Medicare. Part B. Okay? See if I can do this time. Aha. Okay. So this is B and D. So if you're individual tax return and you're a single filer, okay, if your income's under $106,000, you're going to pay $185 a month for your Medicare Part B. If you're a joint tax return, husband and wife, and you're under $212, it's $185, and then it starts going up. Okay, so if you make between the $106,001 and the $133, now your premium goes to $259, and that fluctuates year to year. Say you sold a property, you made $400,000, right? Well, now all of a sudden you're going to be down. Oh yeah, I got a typo there. Sorry about that, guys. This should be 130 something. So you could be up to the max if you're making over 500,000 would be $628 a month. This is what everybody in the country pays. Okay, so it depends on your income. If you say, let's say you retired and you are making $200,000 a year, now you have no income, you can appeal what they charge you, but the minimum is going to be $185, and that's something you always call me one-on-one. We can go over that. Okay, but just to give you an idea, they also charge you. And this is actually what they call IRMA, Income-Related Modified Adjustment for the Medicare. If you make over those certain amounts, you're going to pay extra on your prescription drug card also, besides the monthly premium for the card. Okay? And I like those sheets are in there for you. Okay, when do I do Medicare? There's a couple factors here. Technically, everybody in the country is eligible. They have a 7-month open enrollment. 7 months or 3 months before your 65th birthday, month of, and 3 months after. Okay? 3 months before, month of, and 3 months after. That's when you have to make sure you're on the right path to what you're doing. There's some exceptions. If you work for a large employer, okay, you have to talk to their HR department and see if you need Medicare or not. Large group plans will let you stay on there and you don't need your Medicare, and you get a special enrollment period later. Okay, but for us, an example, myself at Dempsey Weiss, I have this 7-month window, right? Yep, 3 months before your 65th birthday, the month of, and 3 months after. And I'll tell you that comes in important later. So you're eligible the first of the month you turn 65. It's critical to enroll during this. If you enroll later, 10 to 15% penalties on your Part B if you don't do it when you're eligible, and that's for life on that 185. Okay, so you're right on path. All right, so that's, you got to keep these things in mind. So open enrollment starts June 1st. So this person's born September 10th, right? They'll start their coverage on September 1st, but June to December 31st is the window they have to make sure they have everything in place. Okay. All right. So eligibility when you're 65 could also be due to disability. People can be under age 65, but they've been declared disabled. They maybe had SSI for 24 months. Now they're collecting. All of these, it always applies if you work the 40 quarters or more and have paid your Medicare and Social Security taxes. The Part A is at no charge. And also, if you've been diagnosed with ALS or they say ESRD, I forget what that stands for, they're automatically eligible. You're right in. Yeah, you're right in. Okay. All right. So here's where things get a little tricky. So if you're collecting Social Security, say you started collecting at 62, Medicare is going to mail you your ID card the first of the month you're turning 65, right? My birthday is February 1st. If I was collecting Social Security a couple months ahead of time, I'm going to get a card that says, hey, here's your Medicare A and B February 1st. Okay. If you are not collecting Social Security, you are not notified. It is on you to sign up for Medicare. Okay. And I've had clients over the years, a lot of farmers, they're like, I got my individual health policy. I don't want to do this crap. I'm just going to stay on my individual plan. And then they call me 6 months later and they go, they're not paying my claims. Why not? Because when you hit 65, regular insurance plans aren't going to pay for your claims. They're not going to do it. Okay. And then the poor gentleman I was talking about, he had to wait. They wouldn't enroll him in A and B until January 1st of the next year. And he got the 15% penalty for life on the Part B. All right. So if you're just not sure, there's cards in all the files, call us. That's what we do. We do a lot of this education just to kind of get you on the right path. Okay. How to apply for Medicare. So depending on which path you are, if you like computers or not, you can go down to Social Security and just apply in person. Getting in the door is a little tough some days. The new way is online at medicare.gov or through your SSA, Social Security Administration.gov. Some people might already have an app on Social Security to see what their income's going to be when they retire. You know, they're slowly opening back up. Yeah. I know Bridgeton's open. So, and I know Gloucester County's been open. So, and then, so you can go online and do it. You can go in person. What they've also been doing, you can call the 1-800-Medicare number and schedule a telephone appointment. And they'll call you back on a certain date and time if you don't want to do the computers. Okay. So we highly recommend everyone create an SSA account at any age. I've had one for 15 years just to make sure my employer is reporting my income properly and I'm paying the proper taxes. Because I've had clients where their employers were, quote, taking the money and not paying their taxes. And here they are 20 years later. They're not allowed anymore. It's really tough. That was probably 15, 20 years ago. But also when you go in your SSA account, you can see what you're eligible for at age 62 if you start collecting Social Security, 65, your full retirement, or age 70. And they also have a new mobile app. I haven't tried that. I'd be a little, so there's all kinds of ways to apply. You can do it by phone, you can do it on the computer, or you call us and we walk you through it all. Okay. We've actually, yes? I have a problem with that because most of them tell you, they'll say, well, are you working? Right? When you say you want to apply for Medicare, and they'll go, well, are you working? And if you say yes, oh, you don't need Part B. They don't ask, is it a large employer or a small employer? So you kind of got to know what you're doing. They're really just taking the information. So, and I've had quite a few people actually call me up and go, well, they said I don't need. All right. Penalties for late enrollment. You miss your initial enrollment period, that 7-month window. You can enroll late. You'll be charged a 10% penalty for each 12-month period you were eligible for Part B and did not enroll. Okay? And then you also have to wait till that general enrollment period of January 1st to March 31st to enroll with B. So it gets complicated. So just remember, you got to do it at age 65, 3 months before, even if you give us a call, say, what do I got to do? We'll go over it with you. Okay? All right, this is a little when your initial enrollment begins. Once again, 3 months before your 61st, if you do your sign up 3 months prior, your coverage with Medicare begins on the 1st of your birth month. If you do it during your birth month, it's going to be the day of the month after your birthday. So there's little, depending on when you enroll. Okay. Okay, who pays first? And this is what I was talking about with large employer, small employer. So if you're a member and you're over 65 and you're on a group plan or your spouse's group coverage, right? And the employer has less than 20 employees, Medicare is primary. You need Medicare. Okay. Second one, if the employer has more than 20 employees, the group health plan is primary. You don't need Medicare Part B. Those employers can ask you to enroll in Part A because it helps them with claims and you don't pay for it, right? But this is where the Part B really comes into play, okay? Also, if an employer says to you, well, you need to go get your A and B, but you can stay on our health plan, you're going to be in trouble later because you activated your Part B enrollment. You go to come out of that later, there can be issues. Okay. Mm-hmm. Okay. Right. You'll need to talk to HR and see what they require. Some group plans, you just stay in them. They don't care about Medicare at all. Some companies, they make you enroll in Part A because it doesn't cost you anything and it doesn't penalize you later. Okay. You don't want B because then there's issues later. If they're letting you stay on the group plan, you should not need to enroll in Part B. Well, if you're going to retire, then that's a whole if you're coming off their group plan, then you need your Part B. Because she had employer coverage. So say you, I don't know, you stay on the group plan 3 months after you're 65 and then you retire 3 months later. That's an open enrollment period because you were on a group health plan. Okay? Okay. Yeah. See how it gets? You get all. It depends if your employer requires it. You don't have to do A unless your employer requires it. And when you get in the large group market, they write their own group plans. They kind of make their own rules. And the only reason they ask you to enroll in A is it helps them with claims behind the scenes. You would never notice it, but you don't have to do it unless they ask you to. I have quite a few. No. No, I would say no. If they don't make you, because you're going to get an open enrollment period, right? After you retire, that's a special enrollment period when you come off their plan. Okay. And then the same thing, like if you're disabled and covered under a group, the employer has less than 100 employees, then it's Medicare. So it all depends on how you got your Medicare, you know, that kind of thing. Okay. All right. Did I get the wrong way? All right. These were just, did I? All right. I did that. I'm not good with this stuff. All right. So this is just kind of summarizes what I said earlier. So Part B enrollment. If you're turning 65, you already have your Social Security, you're going to automatically be enrolled in Medicare A and B. They're going to send you a card. Okay. If you're turning 65, not enrolled with Social Security, you have to go and enroll online for your Part B. Okay. And enrolling after age 65. All right. So now let's say you stay on to that. Yes. You're going to make me work this clicky thing. They know I'm challenged. Yes. Okay. Okay. So you may need to make a phone call. You need to talk to your HR and see if she needs the A. And you can call and tell them you don't want the B at this time. Now, here's another thing. Is your group health plan, is it the regular plan you've been on all along, or is it a retiree plan?
One I've been on.
Okay. Because I just came across Junior's client. The employer 20 years ago moved her to a Med Advantage plan. So that's a whole nother nasty scenario. That's that was the one we were working on the other day. So yeah, so you just kind of, this is where you got to talk to HR. Say, does my spouse, she's turned 65, you know, does she need her Part B? All right. But if you're staying on that employer's plan, I'm going to tell you to go, no. You can do the A, but don't do the B. Because also, why would you pay $185 a month for Part B when you don't need it because you're on the group plan? Right?
Next thing,
Okay.
say he doesn't take the fee,
Mm-hmm.
and I retire at the end of the year,
Mhm.
you're going to be able to go back in.
So let's say you're going to retire and you're both going to leave the group plan.
Yeah.
Yep. Then it's a special enrollment for you because you had employer coverage. And the only thing you'll need is proof of that. They'll send you a letter, like a COBRA letter, saying here's all the people that were covered and they're coming off the plan this date. We just need that to send in. Mm-mm. Nope. Once you retire, what we were just talking about here, I always say 60 days. I think you can go to 90. You just want to give yourself wiggle room because Medicare doesn't do anything in a hurry or Social Security. All right. So, example for you guys over here. Now, let's say your employer says you have to enroll in Part A to stay on our plan. Okay. Now you're getting ready to retire and you need your Part B. There's 2 forms you need for Medicare. And basically, it's a form your employer signs off saying, yes, you had coverage through them. And then there's another one where you're saying, yes, I had coverage through them. But you got to take them to Social Security with you. So we have them if you need them. Okay. Come on. That was the 2 forms. Come on. Vince. Yeah, right? Do we lose the internet? Oh, yeah. All right, who shut off the internet?
I did say that Vince fixes everything.
I said, right? Right? Nope. Oh, oh. There we go. There we go. Oh man, now I got to through this again. All right. Yeah, we're good. Okay. Oops, I'm going the wrong way. That helps. Thank you, Vince. All right, there's our 2 forms. Okay. Shut up. All right, so we had, okay. So you have your A and B, right? We'll get you all organized on that. You enroll in what you need to get enrolled in. Then you have a choice of which path you want to take. Do you want to enroll in a Medicare Supplemental plan or do you want to enroll in a Medicare Advantage plan? We offer both. Okay. So here's some just characteristics, the difference between them. Relationship to A and B with this original Medicare and Medicare Supplement. The supplemental plan supplements Medicare, right? Medicare rules and they pick up after Medicare. The Medicare Advantage replaces your Medicare A and B. You still have to have it, but it replaces it with a private insurance carrier. Okay, we'll get into it a little bit more. No private network with Medicare. 99.8% of all hospitals accept Medicare. 98.6% of all doctors accept Medicare. Okay, in a Medicare supplemental plan. If you replace that and go with an Advantage plan, now you got to follow a network. Basically is what it comes down to, whether it's an Aetna or a Humana or the other one, Braven. We sold a lot of those this year. Yep, United, yep. Med Sups, no referrals. Some Med Advantage plans, you need them. Part D included, not with original Medicare. You have to buy a separate drug card. The Med Advantage plans kind of put everything together into one. You have your medical, you have your drug card, it's all in one card. Monthly premiums with Medicare Supplemental, they vary, but they're going to be higher than Med Advantage, okay? Med Advantage, and Dave was talking about this earlier, it's all the flyers you get saying, hey, it's $0, we'll give you $400 a month here, go spend it, da-da-da-da-da. Those are Med Advantage. You're not going to pay a monthly premium, but I'll show you later, you're going to have a higher out-of-pocket than you would with a Med Sup. So it depends on your situation and income you have available for your medical needs, okay? Annual out-of-pocket costs are minimal with supplemental. up to $8,000 on a Medicare Advantage. Might be zero premium, but it all depends on your situation. Guaranteed renewable for life, yes, on the Medicare Supplemental. Medicare Advantage, no. But if they are canceled, there's rights to enroll in a different plan. We did a lot of those. Ashley did this year. Aetna canceled a couple plans. So, they were being canceled. You won't lose your coverage altogether, but you have to enroll in a different Med Advantage plan. And we'll get a little bit more into that. Why do I keep going the wrong way? Sure. Mm-hmm. You have to have your A and B, and it's behind the scenes. Like if you go with, you can, but you have to pass medical underwriting. That's why this open enrollment's so important. That 7-month open enrollment, you can go in any plan you want, no medical questions asked. You're in one of those plans and say the premium goes up a little too much, and you're like, I want to shop. We can shop the other Medicare supplemental plans, okay? But they're going to medically underwrite you just like a life insurance policy, and then can say no. They can never take away the plan you have, a supplemental, when you go in, but if you try to move around, they can say no. So if you go with a Med Advantage plan and you decide, I don't know, you become really sick, you're going to spend $5,000 or $6,000 a year in medical costs, you're not going to be able to get back in a Med Sup. You're not going to be able to get in one. Okay, so that's why it's a real big choice which way you're going. After your open enrollment, yes. Yeah. No, the Med Sup. Medicare Advantage, they don't care about your health. They have an open enrollment period every year. Go back to supplemental, then they're going to medically underwrite you. Yep. If you're healthy, it's fine. I had a couple 85 years old. They take an aspirin a day. They've never had a thing wrong with them. I moved them right through. I'm like, wow. But you have heart issues, you have cancer issues, aneurysms, diabetes is a big one. And now they're adding a lot of mental health. If you're taking too much on that, they're going to say, no, we don't want you. So that's kind of a choice too, right? All right, so what I'm going to go over here is how this is, now notice we were talking Part A and Part B. This is Plan G. So your supplemental plans are labeled plans, not parts. So this could be a plan you supplement your Medicare with, right? You stick with Medicare. This will be behind the scenes. So Part A is all your hospital, right? Semi-private room board. If you just had Medicare, say you got your Medicare A and B, and you're like, I don't want anything else, okay? First column, Medicare, if you go in the hospital for the first 60 days, they're going to pay everything but the first $1,676. That resets every 60 days you're home from the hospital and you're healthy. So that's not an annual deductible, okay? It could be 3 or 4 times in a year. See where the plan pays is? This Plan G will pick that 1676 up and you pay nothing. See that end column? 0, 0, 0. Okay. Plan G is a type of supplemental. So also, and we get this all the time, we are not licensed with every single Medicare supplemental carrier. We're listed with about half of them, at least 15 carriers. Plan G with Bankers, AARP, Aetna, Mutual of Omaha, it's all the same benefits. There's nothing to compare. It's just Plan A, Plan G to Plan N or Plan. This is the richest of the benefits. This replaces the old Plan F that most of our parents had. They had Plan F. They didn't pay a dime out of pocket, right? So anyway, so if you were in the hospital with just Medicare, 30 days more, day 61 to 90, it would cost you $419 a day. The supplemental pays it, okay? Day 91 for the next 60 days, you'd pay $838 a day. I need a red pointer. This number here, if you didn't have anything else, that adds up to about $45,000 out of pocket if you didn't get something to supplement your Medicare, okay, whether it's an Advantage or a Med Sup. I'm sorry? Oh, yeah. There's a whole bunch. There's AARP is United Healthcare. There's Bankers, Aetna, Mutual of Omaha, ACE, Chubb, Aetna. There's a bunch of them. But Plan G benefits, we would just compare rates. They're the exact same benefits. Okay? Most people ask me, what carrier do I prefer? I prefer Aetna, but their rates just went through the roof. So why am I going to pay an extra $50 more a month for an Aetna plan when I can get a Bankers for $50 less a month and it's the same benefits? Unless you want to have an Aetna carrier or something, okay? Skilled nursing facility. You go into skilled nursing, you have a hip replacement, knee replacement. The first 20 days, Medicare pays for everything. Day 21 to 100 would cost you $209 a day, $209 and 50 cents a day if you didn't have a supplemental or an advantage plan. Okay? This plan picks it all up. Big note to everybody, if you go with supplemental, if you are in a skilled nursing facility after 100 days, there is no coverage. Get home. When I'm meeting with husband and wives, I'm like, you two both remember this, and when one of you is sick and in the rehab for day 90, day 85, call me up and I'm gonna tell you, get out of there. Okay? Because there's no coverage. First 3 pints of blood aren't covered by Medicare. Go figure. No fill up, right? But it's covered by your supplemental. Hospice care, you can't really see that. The two carriers work it out and you don't have to worry about it. Okay? Just keep going the wrong way. All right, so that was your Part A hospital benefits. Okay, this is your Part B benefits on your Plan G. So it can be in or out of the hospital. Mainly it's doctors, inpatient, outpatient, surgical services, supplies, therapies, all that, right? Oh man, another typo. There is an annual deductible of $257 this year on Part B only. You pay the first $257, okay? And then the remainder, Medicare pays 80%, the plan's going to pay 20%, and you pay nothing. Right here, over here, I had 185. That was last year's. 257 is the correct annual deduct, and this can change every year. It was 180. It was at 185 a couple years ago. Why do I feel like I put the premium in there? I think I put the monthly premium for Part B in there. Excess charges. So if you're on Medicare Supplemental, you're doing your thing, right? And you go to a doctor and they're like, oh, you got to give me a check for today. Why? What they're doing is if the doctor does not accept full assignment or payment in full from Medicare, they're going to charge you an extra 15%. They're allowed to do that by law. And they're going to want to check that day because most of us look at our medical explanation of benefit, right? And we're going to go, I gave him a check for $50, but Medicare says I should only pay them $46. Why did I? And you call them up, and that's why. Just so you know, it's just they're allowed to do it if they want to. And also, Plan G will reimburse you that 15%. Just so you know. I'm getting long-winded here. Blood, once again, it's not covered. It would go towards the $257 annual deductible. Medicare actually pays if it's diagnostic testing, blood work, lab work, your diagnostics, it's 100% paid by Medicare. And if you want to, run over to the hospital and have it done. You don't have to go to a LabCorp. You don't have to go to a Quest. You don't. Okay. Do I see a question? Oh, okay. No. All right. It's the rest of Part B, and I'll be quick about this. Home health care services. Medicare is not going to give you coverage because you have Alzheimer's. All right. It's a medical policy. All right. So if you have to go, they will pay 100%. And the only example I had was my grandmother was in the hospital. She came home from the hospital. She had developed dementia. We had 3 hours a day where nobody was in the house to keep an eye on her. The doctors left her on a decatheter, which triggered 3 hours a day of a home health care nurse, 100% paid by Medicare. Solved our problem. You know what I mean? And she did need it for other things, but that's the kind of home health care services they're talking about. Not due to not being able to take care of yourself because you have Alzheimer's or dementia. Okay? Foreign travel is not covered by Medicare, but this policy, the Plan G, you have a $250 annual deductible, and then the plan will pay 80% up to $50,000. I recommend travel insurance. I was in South America for 3 weeks last year, and it cost me $180 for the travel insurance. So I don't have to worry about my stuff here. All right, so that's, in a nutshell, kind of how A and B works. Hold on. What am I doing? Aha. Oh. Yeah, I hate this thing. Oh, ta-da, ta-da. I was going the wrong way. It won't go. It's fighting me. Which one? Okay. All right, so which path to choose? We've talked about this. You got your traditional route with a Medicare supplemental and a prescription drug card. That's a government plan, right? But by the way, Medicare is one of the largest run government health plans in the world. Okay. Alternate route is Medicare Advantage plans. They're handled by private carriers. You have to follow their rules. Okay. No matter which path you take, you have to have your Medicare Part B. Okay. Networks apply. I'm not on the right. This is not in the right. Anyway, networks apply on the Advantage. Most Advantage plans include an RX card. May have to have prior authorization for certain services or a referral to see a specialist. Depends on the plan, right? You don't, on the supplemental, you don't need it. You can only enroll at certain times of the year. Okay. Medicare Advantage plans, unless you're new to Medicare, right? You can only enroll or you can only change your benefits October 7th. I just blanked. December 15th. Phew. It's the only time you can change your benefits, right? Same with the prescription cards and Medicare Advantage cards. So Advantage plans work differently than original Medicare, but they're not Medicare. Just keep that in mind. They're not. Okay. Just make sure you understand your Advantage plan if that's the route you're going to take. All right. So once again, Part C is kind of how they envelop what your path you're taking. So you have your Medicare Advantage, private insurance that combines your A, your B, and your D, your drug card. Okay. Sure.
Standalone prescription card.
Prescriptions. Did I miss that? I thought I missed something. All right, let's go back. We'll find it.
Yeah.
See, it won't. Yeah, that's where it was fighting me before, too. It won't let me. There we go. I had to get forceful. Okay. So if you have a Medicare supplemental, you have to have a Medicare drug card. Okay. It's going to be a monthly premium, may or may not have an annual deductible, which up this year is $590 is the highest. And you're going to have some sort of co-pay or co-insurance to $2,000. I will let you all know 2025 was the first year there's ever been a cap on a drug card. I have clients spend $10,000, $15,000, $20,000 a year on medications between these Jardiances and all these, okay? The Biden administration put in a law that said $2,000 was it. That's your highest out-of-pocket, which I think is fabulous. The $2,000 max out-of-pocket was new for 2025, and I have no idea if it's going to be there next year. We have no idea. Okay, so we're taking drug cards a year at a time. So, and I'm curious to see what happens in the market because let's say you're out of pocket for, say you were at $8,000 out of pocket on your prescriptions the year before, and now it's $2,000 this year. That $6,000 difference, the insurance carrier is paying. So something's going to give. Premiums are going to go up. They're going to drop the $2,000 max. We don't know. Okay, and we'll find out probably October 31st, something like that. All right. So is that okay? It just skipped right on by. It's just, I don't like this thing. Once again, you can either stick with your Medicare, which is run by the government, or do the Advantage plans, which is a private insurance. Come on. I'm going the wrong way again. Who gave me this thing? I'm almost through. Just the last couple things are, come on. That's what I'm trying to, yeah. It keeps getting stuck. So the 5 business, let me get my little cheat sheet. You guys all have this too. Let's just run through. So, where'd you go? Oh, I'm done. The internet went out again. So your 5 biggest mistakes, right? Not enrolling with Medicare Part B in time. And this is in your little booklet, right? The 10% penalty. We lost the internet again. COBRA is a tricky little situation. So say you retire, you're over 65, right? And you take COBRA from your employer. No, it doesn't count for your Medicare special enrollment once you give up COBRA. If you go on COBRA, you're stuck on that for 18 months, and then you're going to get penalized for Medicare because you didn't get in your Part B. Okay, that's another little, it's one of the big mistakes. Not analyzing your prescription drugs. And Dave hears me cry every year. The four of us worked our butts off this year because there's not many people that left that do it anymore. If you have your Medicare supplemental plan through us, we will tell you, you'll start getting, Janet will get our lovely little marketing things going out saying, send us your drug list. You've got to analyze your drug costs because the drug cards can drop drugs, add drugs, change prices every year. So you might have a card this year, it's $5 a month, everything's covered, you're happy. January 1st, you go to fill a drug, and all of a sudden you're told, oh, Jardiance isn't covered. There's nothing I can do about it. The only time you can change your card is October 15th to December 7th. So, but what we do, that's one of our services. We will analyze these drugs for you, and we'll make a recommendation. Okay? When I last did this, there was 30 different drug cards. They all have different formularies, tiers, all that kind of stuff, which we'll go over that with you. Medicare Advantage versus the Medigap is the networks and referrals, max out-of-pocket expense. And Medicare Advantage, they offer some little bells and whistles. They'll give you free vision. They'll give you free hearing. You don't get that on Medicare unless it's due to a medical condition, right? You have diabetes, your eye exams are covered. They're still not going to cover frames and hardware. The Advantage plans throw that in there. And dental. Okay, so that's something people look at. Retiree coverage, that's just another thing. Make sure you talk to somebody first before you just say, yeah, I'm staying on here, and don't worry about, with the COBRA. It's really another word for Advantage. See, it used to be Part C was supplemental. Now Part C is Advantage. Part E is Medicare Sup. So it's crazy. It's the combined word for what you're getting to supplement your Medicare A and B. That's really what it is, okay? The fifth biggest thing is listening to friends and family, okay? Unless they are a licensed insurance producer who do Medicare, please call us. Don't take your advice from them. You can listen to them, that's great, but call us and confirm it. How's that? Okay? So, because I get people all the time, well, and my own cousin was one. He lived in Florida. His friend, he had an Advantage plan. I'm trying to talk my cousin into a supplemental because he wanted to come up here to visit. I said, you need the supplemental if you're traveling out of the state. Well, my friend's got this. They're giving him $400 a month and da-da-da-da-da-da-da, and vision and dental, and he's listing all this stuff, and he was getting food delivered for all kinds of stuff. And I looked at him. I said, how well do you know this guy? He goes, I know him good. I said, what's his annual income? I said, is he on Medicaid? He goes, well, he lives in his brother's garage. I'm like, that's a whole nother animal, okay? I said, because if people are getting state benefits, the Medicaid, oh, there's some beautiful things, but I'm like, you need to ask some more important questions, okay? And that's really about it. Now that I've bored you and got the glazed look from everybody, and which I usually get. Sure.
If you retire prior to your full retirement age because of a disability.
Oh, you mean Social Security retirement age? Okay. Doesn't. If you're on disability, you're eligible for Medicare after you get it the 25th month you were declared disabled. All right. So at month 25, that's when you need to make sure they'll automatically enroll you with A and B. And then you make sure you get a supplemental and but that's just disabilities. Everything else, it's 65 for Medicare. And you got to make the decision with your employer. And it's getting tougher and tougher because a lot of people are working past 65. So, questions? I know. That's my job. I do it well, don't I? Sure. Yep. Mm-hmm. It's a separate thing. You'd have A, B, C, and D, right? So you're buying a prescription drug card, Part D. Yeah. That's your whatever you choose to supplement your Medicare. Yep. That would be the one I'd recommend, yeah. It's just now's where you got to make a choice. Yep. Yep. Mm-hmm. By MedSup. Yep. Not on regular Medicare supplemental, no, unless it's medically necessary. So we offer them. We offer Delta Dental and Emeritus. You can purchase on your own. Mm-hmm. If you want it. And don't get me going on dental because I'm sorry, you can make a better bargain than what the policies cover with cash. Yeah. Yeah. It's a $50,000 mouth, I know. So, right. And they're going to have limited benefits too. That's where I kind of get a little annoyed with the vision and the dental because they're like, oh, it's the best thing since if your doctor takes it, so you got to research it all. You have to you just can't assume. See, my problem is most dental, like if you buy it on your own, right? Maybe it's $40 a month for a dental plan. So you're spending $500 a year for the plan. They're only going to pay $1,000 a year in benefits. Mm-hmm. Mm-hmm. Right. Yeah, if you want to. Yeah, you want to have A, B, a sup or an advantage, and a drug card. Yep. Yeah, yeah. Yep. Yep. Pay it, make a deal if they won't. And dental's like $10 a month, $9. Yeah. To get some routine vision and yeah. So right. I know the average premium, like if you go the Med Sup path, is about $350 a month. Med Sup, like if you're getting your Part B, your Med Sup, your income's under the 106, right? You're buying a Med Sup that runs right now between $160, $170 a month, and a drug card depends on your medications, could be $2.30 up to $100. So it's about $350 a month for the standard. Yep. I'd just double it because you're single once you're on Medicare. No more husband and wife. Mm-hmm. But keep in mind with the supplemental, you're only out of pocket is $257 a year. Right? How many of us have high deductibles? If you go in the hospital. No, you're one of them. Teasing. I see a question. Oh, yeah. You know what? And the girls are right. They reminded me if you guys, your single coverage, right, on a Med Sub, but if we put you with the same carrier, you each get a 7% discount, household discount off that monthly premium. You don't want to do that. Mm-hmm. Mm-hmm. Yeah. Now, you can also keep vision and dental under COBRA. I have quite a few people doing that. If you have vision and dental through your employer, well, they would offer them. They should. Oh, okay. 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 Because you hurt yourself on penalties. Yep. We're going to hit you with 10% for every 12 months. Yep. Yeah. And they make you wait until a certain time of year to enroll. Like, let's say it's June and you realize you were on COBRA for 6 months and now you want your B. They may make you wait till January. Penalty plus penalty. Yep.
Now, remind
One second. Okay. That's all right. Okay. I'll come back to you in just a sec. For your union. Yep. Yep. Yeah. Mm-hmm. Okay. You have to check with HR. It could be just a different retiree plan. It could be a Medicare Advantage plan. And you'll know when they start telling you you need Part B. That's when you that's it. You really got to talk to them and be like, what do I have to do here? Is this a Med Advantage? Ask them right out. That's what a lot of the DuPonts did that when they got rid of their regular retiree plans about 15 years ago now. They made a deal with AARP and they forced everybody into a Med Advantage plan. And people just took it because it was their employer, and it might not have been the smart move, but that's what they did. Okay, your question?
I have an Advantage plan. Would you like to hear my episode?
Oh, God. Okay. On a, what kind of plan?
That's from your retirement. Yeah, it's from my retirement, where I work.
Okay.
Yeah.
Mm-hmm. Mm-hmm. Mm-hmm.
My husband next to my
Mm-hmm.
but this premium.
Mm-hmm. And you're in a situation. Mm-hmm. But the problem is you're really, and that plan's through the employer, right? You have that choice of coming out of it or staying in it. I mean, you're not going to be able to go to MedSup, not with the couple conditions you just told me. You're not going to be able to. But there are other Medicare Advantage plans, but we'd really want to seriously, because most of the Advantage plans in New Jersey are $0.
Yeah, but who pays up that what you're not paying? Who pays that?
The insurance carrier, Aetna or whoever you have, if you had United Healthcare.
Who do they get it from? Some people we heard Medicaid pays some.
Depends if you have Medicaid. That's a whole nother, if it's an Advantage plan with Medicaid, that's a whole nother conversation. So we'll talk a little bit more one-on-one. Let me because I know Dave's got to do his thing too.
No, I think we had a question back here too. Did you have a question that you wanted to ask? Bill?
I'm sorry, Medicare. That's all I heard.